because people are really afraid. So therefore, we should be very careful for selecting our words to communicate the bad news that the person is suffering from COVID-19 coronavirus. And declaring azoospermia, that now you are infertile and so you may not be able to produce children. So this is also a news which is really difficult to communicate or comprehend. And similarly, birth of a malformed or deadly baby or death of a loved one, all these areas has to be faced by a clinician, and he has to disclose these bad news with the patient, their relative, and so on. So the goal and purpose of breaking bad news is it will not lessen the pain or suffering, but to facilitate the sufferer to cope in a better way by helping the patient and then family, and they can understand the condition, support patient and family, and minimize risk of overwhelming distress. So why it's difficult to break bad news? It's really a complex communication, and it's really an art that not only involve verbal component of actual news, but also there are it include empathetic response of the doctor to tackle the reaction. It is indeed an art which involve basic principle and skill of communication. While breaking bad news, focus should be on both verbal and non-verbal cues respectively. Now, the art of effective communication in breaking bad news is really important, and this involves three components. One is the verbal, the second is non-verbal, and then the paraverbal. So, as you all know, verbal component deals with the content of the message, including selection of the words or sentences, and non-verbal component include body language like posture, gestures, and facial expression, while the paraverbal component include tone, pitch, pacing, and volume of the voice, how you are communicating, and what should be the distance and tone of the, and even I think the language which you are using, because sometimes the person may be uneducated, so he or she may not be able to comprehend the psychiatric or the medical terminology. So while communicating, most of us focus on the verbal component that constitute only 10% of the message delivered, whereas non-verbal and paranormal component contribute 90% of the total message that is delivered. So therefore, the importance of non-verbal and paranormal component is important. Now, the points to be focused during interview. Number one, we have to pay attention to both verbal and non-verbal clues. Always provide information on what the patient want to know. Discuss nature, course, and prognosis, both short-term and long-term, of the disease and the treatment option available. Discuss in detail regarding necessary and feasibility of the expensive investigation and drugs and their effect on outcome of the disease. Then involve the patient in decision making. We should not be the only person to decide, but let's the doctor, the patient, and even the caregiver should be involved to reach a decision. And another party could be the insurance company. Now put additional efforts in motivating patient regarding adherence to lifestyle modification, and always comprehend detail in simple language, preferably in the local understandable language. And the use of medical abbreviation can have negative impact. So therefore, we should avoid something like this. Now, the model of breaking bad news, there are 5 different models. One model emphasizes that no disclosure should be there at all. Now, this non-disclosure model have some advantage, but have many disadvantages that we'll discuss later on. Then the paternalizing disclosure model. The third is full disclosure model. The fourth is individualized disclosure model, tailored disclosure model. And the fifth one is biopsychosocial model. So if you look at the non-disclosure model, the core feature are under no circumstances patient should be informed. This is their notion, and it is easier, less time consuming to protect for terrible reality. And in our country, most of people try to use this non-disclosure model. Patients are having a lot of serious diseases and they are not told about their condition. The disadvantages include denial of the opportunity to adjust, trust on the doctor and undermine, and opportunity for intervention are lost. For example, if somebody is having serious illness and you are not disclosing, so he or she will not take a step to control that. Or for example, if somebody is really suffering from cancer and he's also taking smoking, tobacco cessation is must in that case. So he will not take care of that, or he will not be able to write his will after death. So this can lead to a lot of complication. And patient compliance less likely, because if you don't tell the patient that you are having hypertension or diabetes, so he or she will not take the medication, or he or she may not focus on the lifestyle modification. The second is paternalizing disclosure model. The core feature of this model is right of the doctor to deliver information in a sugar-coated manner. Here you give the information in such a way that it doesn't disturb the patient emotion, and at the same time it minimizing pain and distress of the patient, because you don't want to give pain and sadness to the person. So therefore you make it and tailor it in such a way that it's like sugar coated. The disadvantage of this model is it is not recommended method, because here you are not giving the adequate information, and you are not, it is not a reality based or evidence based. The third model is full disclosure model. Now the core feature of this model is full information to every patient and facilitate doctor-patient trust, natural support within family. Now these are, apart from this, this has some disadvantage. For example, many frightened or confused, some of the patients are frightened if you disclose that what are the consequences. For example, if you want to give the actual full disclosure, what are these side effects of car or even electricity, the person will refuse to travel in a car, or similarly they will refuse. For example, once I requested the higher authority to give some electrical connection in the Badin area, and most of the people from that poor area, they refused, because उन्हें कहा बिजली तो शॉर्ट मारती है, हम नहीं रखें लगाएंगे, और बड़ी मुश्किल बात उनको समझाना पड़ा मैं. So the negative emotional consequence can be there. Many undermine defense mechanism. For example, denial. Denial is really a defense mechanism in which the person will behave opposite to what is expected. For example, he or she will behave that she's not known about the illness. For example, and we sometimes, all of us sometimes use the denial defense mechanism कि नहीं मेरे बच्चे को ऐसा नहीं हो सकता, या फलां नहीं मर सकता, या ऐसा नहीं हो सकता, ऐसा हो सकता है. The fourth model is individualized disclosure model. The core feature of this model is rate of disclosure are tailored to the desire of the individual party by doctor-patient negotiation. So here you gradually go ahead, and it is ongoing developing process. In a single session or a single time, you cannot give all this information, but with time and gradually and slowly you give this. The disadvantage of this model is it takes time and skills and not cost effective, because you have to waste a lot of time and money, and there may be many sessions required. The fifth model, which is called biopsychosocial model, is actually the recommended model. And here the core features are, it's clear because evidence based, and it is evidence based on informations are provided to the person, keeping in mind the biological, psychological, and social component. And the disadvantages may be that the person may, if he has such a personality where he is unable to cope with stress, he can have a problem. Otherwise, generally, this biopsychosocial model is a really useful model, and it has five the steps model. The steps can be in the form of a mnemonic, which is called spikes. S stand for seating and setting. P is for patient perception. I stand for invitation, and K stand for knowledge. E stand for empathy, and S stand for summarizing plan of action. So this is a mnemonic which gives you the various steps of biopsychosocial model. So what are these steps to giving bad news? Is number one, setting the stage. Find a private place and ensure you have proper amount of time and you are free, and the atmosphere should be user friendly in terms of temperature and noise and so on. Find out what the patient know about his or her illness. We should know what patient want to know. Then find out how much the patient want to know. Tell the information and respond to the feeling. And six is make a plan for next steps. For example, responding to the feeling should be in a culturally appropriate manner. For example, if somebody is weeping in the European country, you can put your shoulder on your hand on her shoulder, but in our culture, it's not considered good thing. So you can offer, if somebody is weeping, you can offer the tissue paper and so on. The ABCD mnemonic for breaking bad news is A stand for advanced preparation, B and B stand for building a therapeutic environmental relationship, C stand for communicating well, and D stand for dealing with patient family reaction, and E stand for encourage and validating emotion. So here you can see that advanced preparation, you have to arrange for adequate time, privacy, and no interruption. And then this is important component that review the relevant information. For example, if you want to deliver communicate about his positive result of COVID, you should know that what is COVID, what is the coronavirus, and how mortality and fatality is there. And then prepare yourself emotionally and mentally rehearse, identify words and phrases to use, and that the words that should be avoided. For example, you will always try, this is a condition which is fatal. The build a therapeutic environment and relationship, determine what and how much the patient want to know, introduce yourself to everyone, warn the patient that the bad news is coming, use touch when appropriate, and that should be in a culturally appropriate manner, and schedule follow-up appointment. Communicate well is ask what the patient, their family already knows. Be frank but compassionate, avoid medical terminology, allow for silence and tears, proceed at the patient space. You can let the patient ventilate, and during silence, you should also give some space to the patient. Have the patient describe his or her understanding of the news. This is important. And allow time to answer question, write thing down and provide written information. The third is the dealing with the patient and family reaction. Assess and respond to the patient and their family emotional reaction. Repeat at each visit. And the fifth is the encourage and validate emotion. That is, explore what the news mean to the patient. Offer realistic hope according to the patient's goal. Generally, we give सुपरफिशियली एवरीथिंग विल बी ओके, हर चीज़ ठीक हो जाएगा, लेकिन वो कहें कि हम और आप और अल्लाह की मदद से सब चीज़ें ठीक हो जाएंगी. इट शुड बी रियलिस्टिक. ये नहीं है कि नहीं सब ठीक हो जाएगा. कैंसर के मरीज़ को या जो है HIV के मरीज़ को, उसमें ये गैर ज़रूरी जो वो है, ज़रूरत से ज़्यादा रीअश्योरेंस ठीक नहीं है. रैशनल होना चाहिए, मंतकी रीअश्योरेंस हो चाहिए. एंड then use interdisciplinary resources, because there are other resources which can be useful for the person. And take care of your own need. Be attuned to the needs of the involved house staff and officer and hospitalized personnel, because until unless we take care of ourselves, for example, during this pandemic of COVID, the doctor, the nurses and paramedical staff are overworked, they are near to burnout, so therefore they have to take care of themselves. So here you can see the 6-step protocol for breaking bad news. Here you can say that do's and don't. The spike is comprising of sitting, that means the established right sitting of the patient, and allocate adequate time for encounter. This is you should do, and you should not do interruption. If you see that there are interruption in the sitting or setting, it's really problematic. Then perception, find out what the patient perception is, and here you have to avoid assumption. There are sometimes, I can tell you that once our teachers told us that he was very famous teacher, and he disclosed that I was not knowing कि ये जो हराम मगज किसको कहते हैं, कि स्पाइनल कॉर्ड को कहते हैं. So therefore we should not assume that the person is already aware of the COVID or the HIV, because people don't understand that HIV positive does not mean AIDS. So therefore AIDS is really complication, while HIV is the precondition which can be reversed, or the AIDS is really complication. So therefore we should know. Then invitation, obtain a clear invitation by the patient to give information. And here what you have to avoid, blunt disclosure should be avoided. Then knowledge, use the patient current understanding of his or her condition as a starting point to provide knowledge and medical facts, because there are many misconceptions. For example, now during this COVID pandemic, people say this ye ek sazish hai, who somebody says that no, it's not an illness, there is no virus. So, and what are the complications? Some due to media, they consider is highly fatal. Unfortunately, it's not. Its mortality or fatality is less than HIV or even the other hepatitis. So therefore, we should the avoiding things should be medical jargons or terminology should be avoided. And for example, if you want to explain what is DNA, RNA, patient may not know what is DNA. So, and then the other component is empathy, that is be empathic. This must be very hard for you. For example, you can say कि आपके लिए बड़ा मुश्किल है इसको हजम करना, या लेकिन ये हकीकत है कि ये एक पेंडेमिक आपके बच्चे को हो गया है, कोविड हो गया है, और या जो है खुदा खासा उसकी जो है वो दिमागी तौर पर पसमानदा है. लेकिन and therefore it is important that we should keep ourselves at the place of the person, so that we can understand his or her emotion. Then the last one is the strategy. Explain your treatment strategy, encourage the patient participation in decision making, and even the caregiver. Summarize main point, answer question, negotiate contact. So therefore, we have to give the person that you are having, for example, breast cancer. Now the options can be कि या तो हम आपको मास्टेक्टमी कर दें, रिमूव कर दें, या रेडिएशन कर दें, या जो है पैलिएटिव ट्रीटमेंट करें. तो इस तरीके से सिमिलरली इफ समबडी इज हैविंग रीनल स्टोन, वी शुड एक्सप्लेन द स्ट्रेटेजी कि या तो हाइड्रेशन, रिहाइड्रेशन से आपको पानी बार बार पीने से इसको वो इसका इंतजार करें कि रिमूव हो. द सेकंड कुड बी कि नहीं हम जो है लेजर से कर लें. थर्ड कुड बी ऑपरेशन से कर लें. नंबर 4 कि ये आपकी अल्टरनेटिव मेथड है, होम्योपैथी फलां फलां, ये सारा जो इस्तेमाल कर सकते हैं. तो ये सारी चीज़ों को उसे ऑप्शन देना चाहिए कि इसके व्हाट आर द सक्सेस रेट, व्हाट आर द कॉम्प्लिकेशन, व्हाट आर द एडवांटेजेस, व्हाट आर द अवेलेबल रिसोर्सेज, एंड व्हाट इज द इकोनॉमिक aspect of the intervention. Let me give you an example. For example, if somebody is suffering from depression, we have many options. One is non-pharmacological, which can include lifestyle modification. The other could include some psychotherapy, for psychotherapy in the form of CBT or analytical therapy, or the other therapies are available. The other could be giving an antidepressant. Number 4th can be given ACT. Number 5th, he can be given TMS, that transmagnetic stimulation, and there are so many things. So therefore, the TMS is very expensive as compared to other treatment. I have already discussed that setting up the interview, it is important that we should know about the facts and the basic prognosis and treatment. We should be prepared about this, and ensuring privacy and private setting and sitting down, and not generally it has been observed that the doctors come out from the ICU or the emergency and just disclose in a standing way that आपका बच्चा फौत हो गया, या ये आपके बच्चा जो है वो रिकवर नहीं हुआ, या उसको हार्ट अटैक हो गया. So therefore this is important कि कम से कम बैठने की जगह हो, उसको पानी ऑफर किया जाए हमारे हिसाब से. फिर स्टार्ट ये लिया जाए कि सब कुछ अल्लाह के हाथ में है, हम और आप कोशिश कर सकते हैं. तो इस तरह से और होपफुल टोन होना चाहिए. Then the second step we discussed that assessing the patient perception, and here we are not supposed to assume कि इसको सब पता होगा. So therefore it's better कि आपको ये कोविड के लिए सिलसिले में, या जहनी पसमानदगी के बारे में, या जो है ब्रेस्ट कैंसर के मुतालिक कितनी मालूमात है, ये असेस करना चाहिए, ताकि और फिर इसकी कंसीक्वेंस क्या होते हैं, वो हॉरिबल चीज़ें उनके जहन में होती हैं, उसको वी हैव टू कंट्रोल दैट. For example, when let me give you an example. When जब पहले MRI वजूद में आया तो उसका नाम था NMR, न्यूक्लियर मैग्नेट रेजोनेंस. तो वो जब लोगों को लिखा जाता था कि आप NMR करा लें, तो एकदम घबराते थे कि न्यूक्लियर मीन्स समथिंग टू डू विद कैंसर. तो वो कहते नहीं, मैंने नहीं कराना है. तो फिर लकीली इसका नाम चेंज करके MRI रखा गया कि magnetic and nuclear magnetic resonance. NMR पुराना था और MRI is magnetic. MRI is the new name for this. The step 2 is the assessing the patient perception. Type of question, open-ended question होनी चाहिए, close-ended avoid करनी चाहिए, and leading question should be avoided. And probing nature honi chahiye, and conversation start and review the evaluation. These should be the various. And open-ended question, for example, what do you know about COVID? Well, yeah, what do you know about mental retardation, or what do you know about HIV? So therefore they should understand what you mean by this. Step 3 is the obtaining the patient invitation. why a majority of patients express a desire for full information about their diagnosis, prognosis, and detail of their illness. Some patients do not. So therefore, obtaining clear invitation is important. The fourth is giving knowledge and information to the patient. As I've already discussed you, that warning the patient that the bad news is coming. शुरू से कह सकते हैं कि मुझे ये बताते हुए अफसोस हो रहा है कि मैं कोई अच्छी खबर नहीं दे रहा हूँ, लेकिन मुझे उम्मीद है कि आप सब्र तहम्मुल का मुजाहरा करते हुए इसको सुनने की हिम्मत पैदा करें. Then the fifth is addressing the patient emotion with empathy. Now observe for and allow all emotion reaction using touch, but this touch should be in a gender way and socially appropriate manner. In Europe, you can touch the hands and other shoulders of the opposite sex, but in our country, especially in youngster, one should be very culturally sensitive, and any action should be culturally appropriate. Now, name the feelings. For example, I know this is upsetting. यानी मुझे अंदाजा है कि जब मुझे ये बताना पड़ा कि आपके बाप की रहलत हो गई है या आपका बाप को हार्ट अटैक हो गया है, मुझे अंदाजा है कि आपको बहुत तकलीफ हुई होगी, लेकिन मुझे यकीन है कि आप हिम्मत और सब्र के साथ इस बात को सुनेंगे. And we should be having understanding what the patient is feeling and what we have to say. Respond to empathy. Empathy emotion is respecting that you are asking all the right question. So you can say your question are valid, and I know most of patients who face problem like you are facing can ask such question. So therefore, you should not destroy the hope of the person, but rather recognize this feeling and crying and anger, and let him cry, and you can give him offer him tissue paper or other things, and you can say that अगर मेरे ऊपर भी ऐसा वक्त आता तो शायद मेरी भी आंसू निकलते. And therefore, what to do and in a case where you are providing bad news? First of all, introduce yourself. Then look at the comfort and privacy of the person. Determine what the patient already knows. Warn the patient that the bad news is coming. और वो इस अंदाज से हो कि बुरा भी नहीं लगे कि मुझे ये तकलीफ होती है आपको ये बात बताते हुए, ये बुरी खबर है, लेकिन इसके साथ आपको जो है सब्र के साथ सुननी पड़ेगी. And break the bad news, actual news. Identify the patient main concern. क्योंकि अच्छा जब ये होगा फिर क्या होगा, अगर मेरा बेटा जो है जो पैदा हुआ है उसको जहनी पसमानदी है फिर क्या होगा. तो हम उनसे कहते हैं कि नहीं, बहुत सारे लोगों के यहाँ ऐसे बच्चों की विलादत होती है और वो सब्र तहम्मुल के साथ काम लेते हुए उस बच्चे को जो है फिर उसकी कमी को पूरा कर देते हैं. Summarize and check the understanding. Offer realistic hope. This is very important. हम अक्सर ये कहते हैं कि नहीं सब ठीक हो जाएगा. हाँ, सब तो ठीक हो जाएगा, लेकिन बाज़ औक़ात रियलिटी भी है कि मिसाल के तौर पर अब उसको कैंसर हो गया और मेटास्टेटिक कैंसर हुआ है, पूरी बदन में फैल गया है, उसमें फिर ये नहीं कह सकते कि नहीं सब कुछ एकदम ठीक हो जाएगा. Arrange follow up and make sure that someone is with the patient when he leaves. Therefore, it's important कि unattended नहीं होना चाहिए. Patient sometime commit suicide कि अच्छा मुझे HIV हो गया तो फिर इसकी वजह से सुसाइड करते हैं, और उसको ये बताना पड़ेगा कि HIV does not mean AIDS. HIV एक वायरस का इन्फेक्शन है और AIDS उसकी कॉम्प्लिकेशन है. And how to do it? This is important. Be sensitive. Empathy should be applied. जिस तरह से हमने कहा कि you have to keep yourself at the place of the person and maintain eye contact. Give information in small chunks. Repeat and clarify. Regularly check understanding. Do not be afraid of silence and tears. Let the person have adequate time to emotionally become stable. Explore patient emotion and give him time to respond. Be honest if you are unsure about something. If, for example, you don't know what is the current treatment or current status of the person, you can say, okay, let me identify, I don't know what is the for example, somebody ask you कि हमारे ये जो है जिसको कैंसर बाप को हो गया या माँ को, कितने अरसे जिंदे रहेंगे, तो उससे कहेंगे कि इसके लिए कई पॉइंट्स हैं जिसमें उसकी स्टेजेस हैं, फला हैं। अगर नहीं पता तो हमें जो है उसके लिए कहें कि ये मैं बात मालूम करके अपने साथियों से डिस्कस करके किताब पढ़ के फिर आपको बताता हूँ। Here you can see that make the patient at ease, because he is at dis-ease and you have to make him at ease. But it should be culturally in an appropriate manner. अब जिस तरह से इस तस्वीर में दिखाया है कि अगर बूढ़ी औरत है और उसको आप उसके हाथ टच करके कह रहे हैं माँ की तरह, तो माँ जी कह सकते हैं या बहन जी कह सकते हैं, लेकिन जनरली हमारे यहाँ खास तौर पर अनएजुकेटेड लोगों में ऐसे कंधे पे हाथ रख देना या हाथ ऐसे पकड़ लेना ये अच्छा मुनासिब नहीं समझा जाता। तो लिहाजा हमें इस बात को ख्याल मद्देनजर रखते हुए उसको जो है तबकी दें उसे, लेकिन ऐसे अंदाज में कि वो उसमें लगे कि आप दिल से और खुलूस से कर रहे हैं। Then there are things that should not be done. What not to do in a case of bad news? One should not be in hurry. जनरली हमारे यहाँ है कि मोबाइल भी इधर है, उधर देख भी रहे हैं, घड़ी भी देख रहे हैं, ऐसे नहीं होना चाहिए। गिव ऑल द इंफॉर्मेशन इन वन गो। गिव टू मच इंफॉर्मेशन। इफ यू वन गो में सारी कुछ बता देंगे तो उसका अंदाजा नहीं होगा। एंड जरूरत से ज्यादा इंफॉर्मेशन और आल्सो नॉट गुड। पार्शली उसको समझा के सो दैट द पर्सन कैन कम्प्रीहेंड। यूज medical jargon and unclear language, words or terminology must be avoided. And lie, झूठ भी नहीं बोलना चाहिए, and be economically with the truth, हकीकत पसंद बने, and rational किस्म की वो देनी है कि नहीं जी मेरा बच्चा बच जाएगा, आपसे कहते हैं हाँ बच जाएगा भाई, उसको फिर ऐसे अंदाज में जो है गैर ज़रूरी वो नहीं देना चाहिए। And one should avoid to be blunt. Words should be like loaded pistol and guns. ये भी नहीं हो कि धड़ धड़ आपने पुनः सुना दिया एक किस्सा जिस तरह खबरें पढ़ के सुना दी। Guess the prognosis. She has got 6 months, maybe 7 months. मतलब इस तरह से गैस किस्म का प्रोग्नोसिस कि नहीं यूं होगा, उसके बाद हम बता सकते हैं कि नहीं ये वक्त बताएगा, लेकिन जनरली इसमें ये देखा गया है कि इसका आउटकम ये है, और अगर लोग ख्याल रखते हैं तो ये बढ़ भी सकती है इसकी जिंदगी। Now this is the last slide. They pay special attention while breaking bad news because the Adam says that nothing travel faster than the spread of light, with the possible exception of bad news, which obeys its own special laws. So therefore, we should be very careful. अगर bad news बताते हैं तो किस अंदाज से it travels not only to the patient, their caregiver, their families, and so on. मिसाल के तौर पर आजकल अगर हम ये कोविड के सिलसिले में बात करें कि